Hernias. Once we have been diagnosed with hernia, we always have a question with the doctor, whether we have to hurry up for surgery or whether are there any medicines available to get it cured, or what will happen if I delay the surgery, what will be the problems with the complication, will you be able to rectify it even after it is getting complicated. All those questions will arise in our brain, and today we'll discuss each and everything in detail. I'm Dr. Ashok, Sri Chakta Hospital and Shakti Fertility. Do subscribe to our channel, and please leave your valuable comments below so that we'll discuss further about it. Hernias. What are hernias exactly? So hernias, as we know earlier, it is we imagine our abdomen as a closed cylinder with full of contents like liver, spleen, small intestine, large intestine, and all other organs. And if there is a defect in the musculature of the abdomen, like a small weak spot, the contents of the abdomen, it will find its way through that weak spot outside the abdominal muscles, and it will have a small bulging like appearance underneath the skin. So many a times it will be an incidental finding, like when we bath or when we cough or when we go to a doctor or when we get a scan done or whatever. For a normal people, we will find it in an incidental manner and then get it checked with the doctor, and will be diagnosed with a hernia, and they will be advising surgeries. So once we hear about the word surgery, we will be in a very panicking situation, and the questions all arises. All these days I was normal, and all of a sudden, why should I go for a surgery? As we know, surgery is the only option for hernia, and medications don't help at all. So there is only surgical option left over. We may take some time for us to physically, mentally, and financially prepare for surgeries. So in this waiting time, what all precautions we can take so that it doesn't get complicated, we'll see one by one. And also we'll learn about the complications, what all the symptoms of complications, so that at least at the complication stage we should get attended by a surgeon, and what will be the best treatment option at the earliest available for hernia. So number one precaution to be taken is the weight lifting. So hernia happens because of the increased abdominal pressure, we know it, and because of the pressure, the contents of the abdomen bulges through the weak spot of the abdominal musculature. So once we start lifting the pressure, what happens is the abdominal muscles also gets tightened, and the weak spot also gets narrowed down, so that the contents of the abdomen, like small intestine and large intestines, all those things, it will get narrowed and got stuck in the small opening, and it will cause intense pain, and it will start progressing in a faster way towards the complications. So always avoid lifting heavy weights. And once there is a situation to lift a heavy weight also, you can always keep your hand above the hernia and then slowly massage it, and then reduce it to fully, so that the contents of the hernia goes inside the abdomen, and after that you can lift the weight. So in this maneuver, you are creating a substitute for your defect, like with the hand, so that the herniated bowels don't get stuck and get complicated. And second important precaution what we can all follow is, if at all if you are lifting weight also, hernia truss, or lift a weight in a squatting position like that. So third important thing, the increasing the intra-abdominal pressure. Always try to prevent the factors which increase the intra-abdominal pressure, namely when we sneeze or when we cough or when we urinate. When we micturition, when we urinate, we will increase our abdominal pressure. Elderly males usually do it. And during constipation also, we strain for passing stools. All these things eventually leads to the increase in the abdominal pressure, and then it will also gradually increase the chances of hernia, and the bulge also becomes quickly worsened day by day. And next important factor is the body weight. We all know the obesity is the killer disease, and it will make all the abdominal musculature very lax. As well, it will weaken our muscle wall, and the weak spot also becomes more weaker, so that the hernia, it will fastly move towards its own complication state. So once you are fix your mind for surgery, and if you are taking a time for surgery, always concentrate on bringing down your body weight. It will always help you to make you recover after surgery also very well. And the other thing is the long travel and straining in the work. So traveling, stress and strain, always it will make your abdominal muscles move very vigorously, and then all the weak spots become more weaker day by day. So always avoid the long distance travel and weightlifting as well. So once we are getting all these precautions, we should learn about few alarming signs when it's going to go for complications. There are three main important complications. Number one is the irreducibility. That is, since then we have been knowing about hernia, it always bulges out and then goes inside the abdomen. So once the process of going in gets stopped, the contents gets outside the abdomen and it gets stays there itself. This is called irreducible inguinal hernia. So that is the number one thing. Whatever hernia which doesn't goes in, it is going to get complicated. Number one. Number two is the obstruction. As we know, the contents of the hernia is usually the small intestine or the large intestine. It has the food and all fecal matter. So whenever the hernia gets obstructed, the food path also gets obstructed. It creates an intense pain after the obstruction. We may have vomiting, fever, constipation, all those things happens. Abdomen becomes very bloated. All these symptoms are the complications of obstruction. And the third important complication is the strangulation. The contents of the hernia, whatever may be, the blood supply always comes from the abdomen. Once the ring becomes very close, the blood supply also starts cutting down and the hernia goes in for a necrosed or gangrenous state. In that situation, we'll start having fever and we'll be very sick. So these three symptoms, all the symptoms of the complication, always keep in mind. And if there is a situation, immediately rush to your nearest doctor and then discuss with them and then take a quick decision towards the surgery. As we all know, the hernia doesn't get cured with medications. There are only options of surgical interventions alone. There are two types of surgeries, namely the open and the laparoscopic one. Open is a very outdated and very crude method dealt in older days. In a modern era of laparoscopy and robotic surgeries, we always go in for the laparoscopic hernia mesh plasties. Today, excellent prosthetic meshes have been invented so that we will not have even a single drop of blood, no pain, no scar, and it is almost nowadays it's a fast track surgery. We get admitted in the morning, get it operated, take rest in the afternoon, and evening you'll be back at home with in your own beds recovering quickly. So we'll don't hurry up for hernia surgery. The take home message is there is always surgical options for hernia. But wise people take wise decision and get it operated at the earliest so that to prevent all the complications. Happy living. Thank you very much.